Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you a handful of exercises that you can use the Physio ball to work on your knee range of motion and mobility after knee replacement therapy. Before I jump into that, be sure to hit that subscribe button, turn on the notifications to catch all of our latest videos. So the first thing I'll show you is just in sitting on a Physio ball, and you're going to keep your feet planted on the ground, and all you want to do is start to kind of move around nice and gently. So you can do some circles back and forth or some pelvic circles. And what you'll notice is if you keep your foot planted, your knee is going to have to bend and move in relation to your body and the ball. So your surgical leg is planted in a firm surface and you're moving your body in relation to that surface. So you can do circles, clockwise, counterclockwise. You can shift your weight forward, and that's really going to start to get some flexion and bending through the knee. Shift your weight backward to relax off of it. So you can do just shifting forward and backward. You can do a little bit diagonal or side to side. So we kind of do a diagonal forward into the knee, come back, do a diagonal into the other knee. Just playing around with different movements and positions of your body while keeping your leg planted is going to take your surgical leg, your knee, through some different range of motion and movements. So that's the first one, is just sitting and moving your body, shifting your body weight back and forth and moving it on a stable leg, and that's causing some flexion and some bending of the knees. The next thing we're going to do is lay down. So if you can do this on your bed, or if you have a table, or if you feel comfortable getting up and down from the ground, that's great. But at least initially you might want to do this from a mat table or your bed or something similar. And the first thing you can do, the Physio ball is really good for just elevating your legs. So getting your legs up on top of the Physio ball, or just your surgical leg if you want. It's a good way. You can get that 30, 45 degrees of elevation to help manage swelling, inflammation, edema after surgery. You can incorporate some things when you're in this position, so you don't just have to be sedentary. So you can put a compression wrap around your leg to help aid with the swelling. You can just do some ankle pumps as you're in this position, pumping the ankles, working that muscle pump to help increase the flushing out of fluid and swelling. You can do some quad sets, pushing the knee down, trying to straighten that knee, hold it for a few seconds, and relax. Push down and relax. So a good way to get the legs up in the air without having to stack a ton of pillows. You can also do some active exercises. So a great way to manage swelling. So, putting your legs up 10 minutes, 15, 20 minutes at a time. Also laying down, we can do some different exercises. So one of them, I like to do this as just kind of a general warm-up. It also feels good for the low back. So you have both your legs up on the Physio ball, and you're just going to slowly try to rotate your torso and rotate your legs side to side. And you can go as far as you're comfortable. You can go quite far if you want, or if you're not quite ready for that, just do short, small movements side to side. And what I notice is this is kind of just a good warm-up for your hips and your pelvis and your low back. And also you notice your leg is in that flexed and bent position. So just trying to calm things down so you can tolerate some of your other exercises. And then the big one, the one probably most common with the Physio ball, which is great for working on hamstrings and also great for knee range of motion. So you start with your legs out in front of you on the ball, and you're just going to bend your knees and your hips, bringing it towards you, and then back out. So the easiest way to do it, and the way I recommend starting, is with your hips and pelvis on the surface, on the ground or the mat, and just going in and out with your legs, working just specifically on that flexion of the knees and hamstring activation. To make it a little more challenging, there's a couple different things. So you can lift up into a bridge, lifting your hips and pelvis off the surface, and then going in and out like this. This is really going to activate both your glutes, and you'll feel it, those hamstring muscles will be really engaged as you do it, as well as your core and abdominal muscles. You can also do just one leg. So if you just want to work on the surgical leg, bending it forward and back, either with your hips on the ground or coming up off the ground and doing it that way. So that's a great one for activating your hamstrings, working on your knee flexion. And the last one I like to do with the Physio ball is using it for wall squats. So I'm probably getting a little too close here, but putting the ball up against the wall. And the great thing with this is you can really get your feet far out in front of you, so you're not putting quite as much stress through your knees. Your knees aren't going forward over your feet and toes quite as much. And you just squat down and come back up. And you can do just repetitions up and down, or you can get down into that squat position and see if you can hold it. Really engage those abdominals, engage your glutes and your hip muscles, your quadriceps, you'll feel it, and come back up. So wall squats with the Physio ball, really good exercise, really nice that you can get your feet far forward. Try to emphasize more through the hips and not put quite as much stress through your knees as you do it. So there's just a couple different exercises that you can use the Physio ball for. Work on your strengthening, work on swelling management, work on knee flexion, range of motion, and bending. Hope you found this video helpful and insightful. If you have other great exercises using the Physio ball, let me know in the comments. Leave your questions and other comments below. Smash that like button. Thank you very much for watching.